Hi, I'm Maddie Shetler, and today we are going to be talking about the access to mental health care. We will take a deeper look at one of the most significant challenges facing communities across the United States. Mental health affects every demographic, yet millions are unable to get the care they need. Our main goal with this presentation is to break down the barriers, examine the pros and cons, and offer meaningful recommendations that align with social work values. Let's get into it. Why this topic matters. Mental health conditions impact nearly 1 in 5 adults each year, making access to care not only a public health concern, but a social justice issue. Social workers often encounter clients navigating complex emotional, financial, and systematic barriers. This topic matters when mental health needs are unmet, families struggle, communities are strained, and long-term outcomes worsen. Our responsibility is to support systems that make care accessible, affordable, and also it is really important that they are culturally appropriate. Key issues. There are 4 major issues that influence mental health access: financial barriers, provider shortages, stigma, and broader systematic inequalities. These issues are interconnected and oftentimes they overlap. For example, a person may not seek treatment due to stigma, but even if they overcome that barrier, they may encounter long wait lists or lack of insurance coverage. Understanding how these issues interact helps social workers advocate more effectively and clearly. And again, systematic inequalities in healthcare distribution create significant obstacles affecting marginalized communities disproportionately and leading to inadequate access to mental health services and resources for those who need. Financial barriers. One of the greatest obstacles is cost. Even individuals with insurance often face high deductibles, copays, or limited session coverage. For those uninsured or underinsured, therapy can be completely out of reach. Many mental health specialists do not accept insurance at all due to low reimbursement rates. This pushes services into the private pay market, which increases inequality and restricts care to only those who can afford it. Moving on to provider shortages and understanding the workforce gap. The United States is currently experiencing a mental health workforce crisis. I know this firsthand with working with the J Foundation as my project for this class. I have seen in Twin Falls, Idaho, a gap of people needing to get into counseling, and the actual ability for them to do so is oftentimes an 8 to 9 week gap in between that. More than half of countries do not even have one practicing psychiatrist, and shortages extend to psychologists, therapists, and licensed clinical social workers. Rural areas face the most severe gaps, where individuals may need to travel long hours to receive care. Provider shortages lead to burnout among existing providers, long wait lists, and reduced appointment availability. So as you can see, this issue is continually growing, and it's really affecting people's view on getting counseling, because if you're in a crisis situation, as with serious issues like suicide, you just don't see the help immediately like you need it. which is a huge problem. Moving on, we're going to be looking at stigma and barriers and understanding cultural challenges. So, despite progress in recent years, stigma continues to influence whether people seek help. In some cultural or religious communities, mental health struggles are viewed as personal failures or even spiritual weaknesses. I've seen this in my own community with church, and oftentimes looking at mental health disorders as sinful behavior or perhaps even demonic. Sometimes individuals do not feel represented or understood by mental health providers, and culturally competent care is essential. Clients need practitioners who understand their lived experiences, languages, values, and community context. All right, moving on. All right, to inequalities. So these inequalities disproportionately affect people experiencing homelessness, people who are in jail, and also in poverty. These groups often have co-occurring conditions, limited access to treatment, and fewer supportive resources. Many rely heavily on emergency rooms for crisis care because long-term services just aren't available to them, unfortunately. Structural inequalities, from lack of transportation to discriminatory practices, can really compound mental health challenges and arise to severe consequences. Moving on. Recent improvements to access. We're going to kind of go on the flip side of things. So despite all of these many challenges that we have seen, there have been major improvements. Telehealth dramatically increased access, especially after the COVID-19 pandemic. Many people who could not previously attend in-person therapy now meet with providers from the comfort of their homes. This has also provided a lot of improvement with people actually attending counseling and going to their appointments, because it's a lot easier for most people to hop on a telehealth rather than drive somewhere, sit down, carve out the time for telehealth counseling or for in-person counseling. So telehealth helps reduce stigma because care is private, flexible, and super convenient. All right, moving on. So more recent improvements in care. We see the 988 hotline, and then also community programs, which we'll dive into. So another positive shift is improved legislation. The Mental Health Parity and Addiction Equity Act requires insurance companies to treat mental health care just the same as physical health care. The rollout of the 988 Suicide and Crisis Lifeline provides immediate crisis intervention and has already helped thousands. Community-based programs, including peer support groups and mobile crisis units, are expanding nationwide. Also, community programs have emerged. Like I said, my involvement with a local nonprofit called the J Foundation, I have seen immense growth and improvement within our community as far as suicide prevention and mental health care. It's been really cool. We've seen suicide notes ripped up. We've seen immediate in-house counseling practices, which have helped numerous people. And then we've also seen 12 different initiatives for the community that everyone can be engaged in and be a part of if they'd like to. All right, let's move on to the ongoing barriers. So even with improvements, there's still a lot of barriers that exist. Telehealth can expand reach, but it also excludes those without internet access, technology, or privacy at home. Insurance parity laws exist but are not always enforced. Waitlists for therapists can extend up to 6 months in some regions, making timely intervention nearly impossible during crisis. Guys, imagine waiting 6 months if you were in a serious need, critical condition for counseling. I just can't imagine that. But unfortunately, that is reality for most people. To continue this, marginalized communities continue to face disparities. Indigenous, Black, and Latinx individuals experience higher rates of mental health needs, but significantly lower access to care. Language barriers, limited funding for community clinics, and a lack of representation among providers all contribute to persistent inequalities. Without comprehensive policy reform, these disparities will, in fact, continue, unfortunately. Okay, here is some federal and state facts. The federal government has made efforts to expand services through SAMHSA grants and crisis response funding. However, individual states may vary widely in how they support mental health. For example, Idaho consistently ranks among states with the lowest mental health access due to rural geography and limited providers. If you were to look at like California, in contrast, their states have expanded Medicare to cover more behavioral services. There's more crisis centers and even like early intervention programs. We don't see a whole lot of those in Idaho, although there are still some. Moving on to here we go to some recommendations. So our recommendations focus on long-term sustainable improvements. First, what we would do is we would advocate for increased funding for community mental health centers, which can provide affordable services regardless of your insurance status. I know this would be huge in the city that I am from. Second, we would start with improving telehealth infrastructure, especially rural broadband would be essential. And then third, we would enforcing parity laws will ensure insurers cannot unfairly limit mental health coverage. I know that this would be huge if implemented correctly. Moving on. So moving on to more recommendations, we would also recommend expanding the mental health workforce through scholarships, loan forgiveness, and competitive pay for social workers and clinicians. Culturally, competent training should be standard for all mental health providers. That's just a given. Mobile crisis teams should be widely available to reduce reliance on law enforcement during mental health emergencies. Strengthening school-based mental health services will also help in just kind of getting ahead of the problem and support like early intervention for people. So for my inclusion, just to wrap up, in conclusion, access to mental health care is a foundational aspect of community well-being. As future social workers, we play a seriously critical role in advocating for policy reform, also supporting underserved populations, and working toward a more well-rounded system. While progress has been made, Continued advocacy and systematic change are vital and necessary to ensure all individuals can have access to mental health care that they deserve. Thank you so much.